Can you explain how significant is this recent spike in cases that we've seen in several European countries? Because we see case numbers go up, but death number is still remaining very low.
Yeah, that's the highest paradox of the pandemic right now, is that since the beginning, the death load has remained quite low and the number of cases has dramatically increased in an exponential manner. So that questions, and we should have lots of research on that, which we don't have so far. Why is there such a difference between the number of death case and the number of people reaching the hospital and the number of people infected? Does it mean that the virus is adapting to its new host, I mean the human host, or does it mean that our measures are doing their job and that we are getting accustomed to the virus in our environment and protecting ourselves? This is a very critical question that many researchers should now address and find answers. Now, what does it mean? So far, there are just variations, because if you look back in the last few weeks ago, you will find that there have been already some huge discrepancies from day to day regarding the number of new cases. It is not quite relevant to focus on day to day or week to week discrepancies. It is more important to look at the general trend at the monthly level, because what you do today impacts what will happen in a month in terms of epidemiologic data. So day-to-day changes are rather a question of how acute is the report of the cases rather than the actual trend that you can rely on. In fact, what you see today is the reflection of what you've done last month. And it is the reason why it's difficult to take decisions, because your decisions will impact the situation in 1 month ahead, and you will see the results within 2 months ahead. So it's quite difficult to steer that kind of pandemic because of that cynetic.
One of the issues that I mentioned a moment ago that a lot of governments are dealing with now is children returning to school. It's due to happen in the next couple of weeks in many countries across Europe. What are the particular concerns when it comes to children going back to school, and what that should mean or could mean for the spread of the virus?
Well, it depends on what kind of youth you are referring to. If you are referring to children below 7 years old, then they are likely to be contaminated, and some of them may develop a very nasty disease linked to the virus, which is the Kawasaki disease, which will impact their blood vessels and the development of their blood vessels.
But that's in a very small number of cases. I'm conscious there could be parents watching here. That's a very small number of cases of those who contract coronavirus. Is that correct?
Yes, very, very small, but when it happens, it's a big issue. So that's one thing. Many of them will be hit by the virus, because the coronavirus are very tricky viruses among children. I mean very young children, because young children develop only what we call cellular defense against it. They don't develop much of antibodies, and antibodies are made to protect yourself from the viruses. So what they have is a huge inflammatory reaction. That means why the children are always snoring, always have a sneezing with the nose, and have a flu cold, as we call. That's the symptoms of the coronavirus, the normal coronavirus, the one that is responsible for children sneezing. But when you come to the other side of the population, the old people, inflammatory response is very nasty and is responsible for the distress respiratory symptoms that you see, and that is really deadly among the elders. What will happen is that young children are likely to infect their older parents and the elders that they are living with. So that's the main concern for the coming weeks, how it will impact the cynetic of this of the whole in the whole Europe specifically, when all the children going back to school will contaminate each other and contaminate the elders. We'll see what happens, because nobody can anticipate that right now.
Briefly, if I can ask you, should we be worried then if cases go up when children go back to school because of the low death toll, or is that a mitigated risk?
We should worry because we don't know what will happen, definitely. Is that, are we going to face only children getting infected but with very low incidence in terms of mortality and disease? In that case, it's not too bad, but there will be no herd immunity coming from the children because children do not develop antibodies from coronaviruses. Coronaviruses have a very specific behavior among children that makes them completely different from other kind of viruses. That's something we have to bear in mind.
Okay. Jan-Cedric Hansen from the Global Health Security Alliance, thank you very much for your time today.